Everyone worried about an unplanned pregnancy needs to know about emergency contraception, including what it can and cannot do. In a perfect world, we wouldn't need emergency contraception. But in the real world, condoms break, birth control pills get forgotten, and people get assaulted. In Canada, emergency contraceptive pills, or ECP, contain a synthetic hormone called levonorgestrel. Currently, this is the only formulation approved in Canada. Levonorgestrel is a hormone that can be found in some birth control pills at very low doses. The goal is to give you a big dose of this contraceptive at the last minute in the hopes that your ovaries won't release any eggs. Because this is a last-ditch effort to keep the egg and the sperm away from each other, it is important to take emergency contraception as soon as humanly possible. Where do you get it? You can get it at any store with a pharmacy or family planning section. You don't need a prescription, but you will need a few dollars. When you go into the pharmacy, just look in the condom section. If you don't see it there, ask at the pharmacy counter because some places do keep it behind the counter. And if for any reason you can't get it at that store, just go to another store. They're likely to have it. The brand name ECP that's available in Canada is called Plan B. Brands including Next Choice, which may save you a few bucks. Generic and brand names contain the same active ingredients, so they should work the same. If you can afford the 30 bucks, buy a pack ahead of time. Store it somewhere other than your bathroom, just in your dresser or nightstand, and then you'll have it ready to go in case you need it. Remember, replace it if it expires. It's better than nothing, but always make sure you have a fresh version in there in case you do have a contraceptive accident. Side effects from ECP are minimal, which is why you don't need a prescription to buy them. They don't contain any estrogen, which is the troublemaker in regular contraceptives that may cause blood clots in some folks. And of course, if you're breastfeeding, you can take it and it won't affect your milk supply. After taking ECP, some people may experience a bit of nausea. If you have a tendency to get queasy from medicine, just know that beforehand and maybe take an anti-nauseant like Gravol along with your dosage. Just stay away from antacids because those could interfere with the absorption. If you get really queasy and you do throw up within about 2 hours of taking your emergency contraceptives, just call the pharmacy because you may need another dose. Are you more than 160 or 170 pounds? ECP may not work as well for you as it does for others. Unfortunately, not enough research has been done in this matter. There is some research showing that taking 2 doses at once may increase the amount of the medicine in the bloodstream in the bodies of people who do have a higher body index. So that may be an option. Again, talk to your pharmacist and see if that's something that could work for you. Another option for heavier bodies is a copper IUD. If it's been more than 3 days since you had unprotected sex, you actually have up to 7 days to use copper IUD as emergency contraceptives. The downside to copper IUDs, it does require a few appointments, including one to get the prescription for the IUD and another to get it inserted. And it also costs about $80. Just note, if you do decide to keep your copper IUD, it's as effective as sterilization and has a really low monthly cost. Once you've paid for it, you can have it for up to 5 years. If you don't have any cash on hand for emergency contraceptive pills, and you just happen to be taking one of the birth control pills that contains levonorgestrel, call your pharmacist to find out how many you can take to sort of act like emergency contraceptives. It's better than nothing. Just keep in mind that it's not as effective as going out and buying ECP, and it is definitely going to cause you some nausea. Tell your pharmacist to find out how many pills you need to take if you do already take birth control pills that contain levonorgestrel. Finally, if you are concerned about harming a potential unborn baby, be reassured that ECP has not ever been shown to cause birth defects or anything harmful to a growing baby or the person who's carrying it. Some people do mistake emergency contraceptives as an abortion pill. The two are totally different, and in fact the abortion pill is not even available in Canada yet, which will change in around 2017. In the end, it's your body, and you're right to make decisions that work for you. A few final tips. The sooner you take it, the better it works. So ideally take it within 3 days, even better, take it within 1. ECP does not prevent sexually transmitted infection. So if you've been in a situation where an STI is a concern, you'll have to follow up and get some testing to make sure that you didn't get one. Another great thing, ECP can be taken as often as needed. The only reason it's not recommended as a regular form of birth control is that it's not as effective and it's expensive. There are much better, much cheaper options for you out there. So just talk to your health provider to find one that works for you and your budget. ECP, it's a one-shot deal. So if you have unprotected sex after taking it, you're still going to be at risk for an unplanned pregnancy. Note that anything that interferes with birth control pills like St. John's wort or some forms of antibiotics may also interfere with the working of the ECP. Finally, if you're nursing, it should not affect your milk supply or harm your baby in any way. So if you've just had a baby and you've had a scare, ECP is perfectly safe to take. So, you've taken it. Now what? Keep in mind your menstrual cycle is probably going to change. It may come a bit earlier or it may come a bit later. Just don't panic. If you're still concerned or don't get your period within 3 weeks, consider taking a pregnancy test. People may bleed a bit when they're early in their pregnancy. It's probably not a bad idea to go get a pregnancy test anyway. And this will give you lots of time to either terminate the pregnancy or seek out appropriate prenatal care. So anytime you have a question about drugs or ECP, just talk to your doctor, nurse practitioner, or pharmacist, or of course your sexual health center. We can all help you make informed choices that work for you. So stay safe and have fun.